exclusive interview with Bill Gates, the entrepreneur, Microsoft co-founder, software developer, and philanthropist. Thanks for being here.
Great to talk to you.
The Bill and Melinda Gates Foundation's annual letter has now just come out. You both write about how this pandemic, in your view, will be as defining as World War II. What are the key steps to take right now?
Well, we have to do two things at once. We have to bring this epidemic to an end, primarily by getting the vaccine out in large numbers to the entire world. And we have to make sure that we're ready because there will be another pandemic. And there's so many lessons about how we weren't prepared, how we should have handled things differently. And, you know, when that's clearly in our mind, those investments need to be made.
You mentioned being ready for the next time. And you warned about this last time. Let's take a brief look at a 2015 warning you issued.
If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus. If we start now, we can be ready for the next epidemic.
How ready was the world for this, say on a scale of 1 to 10, and how about the U.S.?
The U.S. gets a low score because the understanding of how to get diagnostics up to scale early to stop the exponential spread, you know, if that had been done well, we would have been more like an Australia or a South Korea, where the death toll is less than a tenth of the tragic situation in the United States. So we made mistakes before the epidemic in not investing more. And then during the epidemic, we also made mistakes. There's one category we did well, which was getting R&D money out to the vaccine companies. The U.S. was the biggest at that. And so at least, you know, in that one area where we've set a model for the world.
You're very specific in your work and the letter about what should come next. You talk about a global alert system, infectious disease first responders, and germ games. Walk us through what some of that looks like and whether you think international organizations and the Biden administration can do more on that now.
Well, the great thing is that the tens of billions required for all that preparedness, it's the insurance policy that avoids you losing tens of trillions like we are globally right now. And so it's quite a bargain, even if you only look at what it can do to help during a pandemic. But those investments can also help us improve health on a much broader basis. So the mRNA vaccine can be used for TB and HIV. You know, we're very excited about that. And we've been funding mRNA for over 10 years, and now it's, you know, accelerated its development. And getting those early warning systems in, that'll improve health all over the world. So this time, I think people will pay attention.
Your letter also goes really through a whole bunch of influences, from the movie Contagion to Winston Churchill to you and your wife's interest in confronting systemic racism and structural racism. And you write that pandemics, quote, exploit pre-existing inequalities. And you're working and doing funding with historically black colleges on testing. Walk us through, what does this mean? Why does it happen this way? Does it have to be this way? And how do you fix it?
Well, it's pretty stunning that the infection rate and death rate in minorities has been over twice as high. And that really wouldn't have been expected. In fact, we need to understand it a lot better. You know, it's partly multi-generational households. It's partly job occupation. You know, it may have been the ability to communicate health messages in to those households. I'm stunned at that. Sadly, I'm not stunned with the idea that the inner city schools were the least prepared with internet connections and training in order to do online education. And so the gap between the suburban schools and the inner city schools, which was already very large and a terrible inequity, it's been more dramatic in this last year than ever. And so we've got to reinvest in those schools, taking some of the good things we've learned about how we can use online tools, but helping those kids catch up.
You know, Mr. Gates, trying to warn about pandemics and then protect people's lives during them doesn't sound that controversial. But as you know, and I think some of our viewers know, you have a lot of critics, including, for example, here's a Fox News host who is attacking you for advocating contact tracing in April. Take a look.
There's a new threat to our rights on the horizon, and it's being pushed by the second wealthiest man in the world. According to Gates, the only way to responsibly end the shutdowns is for a pretty vast surveillance system to be put in place, arguing that it will be unsafe to work or to travel or go to church or a ball game unless we give up our personal data. Well, I haven't seen the scientific proof for any of that.
Is that a fair assessment of what you're trying to do, and what's your response?
Well, contact tracing was incredibly beneficial in places like South Korea. And, we'd have hundreds of thousands of people alive today in the U.S. if we had done that. The data, you don't actually have to give up your personal data. That's not a fair way of describing it. Some societies really chose to make that work. Sadly, because of our mistakes in diagnostics, our numbers got so large that even the states that made an effort, the benefits of the contact tracing wasn't gigantic. So it's really as you get down in, lower infection rates, like 3-4%, then the contact tracing helps drive that down even lower.
When you look at that kind of disagreement or attack, do you see it as just ignorant or also malicious? Because there's a lot on the internet, the stuff that's not true, we're not giving airtime to, but that tries to rope you into something.
Yeah, so both myself and Dr. Fauci have featured in conspiracy theories. Like one says that Dr. Fauci's trying to make money off of these vaccines and various negative things about me. You're encouraging people not to trust the advice on masks or taking the vaccine, and that could be damaging. It's a new phenomena. I don't know, will it hurt the vaccine uptake where everyone who takes the vaccine is not just protecting themselves, but reducing their transmission to other people and allowing society to get back to normal? It's a completely unexpected phenomena. And, sadly, a lot of it's based on false information.
Yeah, just one follow-up on that, which is you're known to be both effective and an optimist. What do you say to people who look at this and feel like scientists, experts, and you warned and gave the public information, and by your own assessment today, it still didn't go very well according to the government policies in charge, and you're out here still working on it? What do you say to people who are pessimistic about either failure or incompetence and lies winning out?
Well,